student A. Is that okay?
Yes.
And can you tell me your name and date of birth?
Charlotte Catherine Cook, March 20th, 2006.
And can you tell me where we are?
Saginaw County, Michigan.
And can you tell me what year it is?
2025.
So you're times 3, so I feel good about continuing. So I'm just going to ask you just some questions real quick. They might be personal. Is that okay?
That's fine.
So do you have any allergies or anything like that?
No.
And then do you have any past or previous medical history?
Oh, exercise-induced asthma, but I have albuterol for that.
Okay. Since you've been prescribed or something for it, I'm going to say that's good. And then do you have any like family history, like COPD or asthma?
My grandmother on my dad's side has COPD. She
Okay.
died though.
Oh, okay. And then for have you ever had any surgeries or anything like that?
I broke my arm when I was 12, but it healed fine.
Okay, that's good. And then for exercise, what is your exercise in a week?
I walk about 2 miles a day.
So it's good exercise. And then what do you eat on a normal basis?
A lot of fruit, definitely meat, potatoes, starches, stuff like that.
Okay, so all those seem good. And it seems like you have a good amount of protein. And then do you take any medications that can be over-the-counter medications or herbal supplements?
Just the albuterol.
Okay. And then do you smoke at all? That can be like marijuana, weed, vaping.
No, I quit doing that.
Okay. And then do you drink any alcohol?
No.
Okay, so now I'm just going to move on with doing your vitals. I'm just going to take your blood pressure. Do you care what arm I take it on?
Nope.
So I'm just going to be real up your left sleeve for me. And then if you could just uncross your legs as well. And then do you have any low or high blood pressure at all?
No.
And then this is just going to be a little tight, just to let you know. And I'm just going to pump that to 140. And so your blood pressure is 122 over 62, which is a good blood pressure. And then for pain, on a scale from 0 to 10, 0 being no pain and 10 being a lot of pain, or just like the worst pain ever, can you tell me what your pain is?
0.
Okay, so that's good. Now I'm just going to take your pulse. Then you can just relax that arm. So your respirations were 18 and your pulse was 72, which is good. And then I'm just going to look at your radial and brachial pulse, just to see if it's symmetrical. So your radial pulse is symmetrical, it's a good rhythm, and it's a strong heartbeat. Now I'm just going to do your brachial. And then your brachial is symmetrical, it's a good pulse and also a good rhythm as well. And then I am just going to take your temperature, and since we don't have a thermometer, I'm just going to do it by your forehead. Have you ever had any like fevers recently or been hot or cold?
No.
Okay. So since we don't have a thermometer, I'm going to assume that you felt good, and so then I'm going to assume that you're within the ranges of 97 to 99 for temperature. Next, I'm just going to look at your hands. So do you have any like shortness of breath or anything like that at all? Okay, so I'm just going to assess for clubbing. And I'm not seeing any signs of clubbing, and since I can tell that you're breathing well and we don't have a pulse ox, I'm going to say you're within the ranges of 95 to 100 room air. And then I'm also just going to next look for, do capillary refill and look for perfusion. So your capillary refill seems good. It's within those 3 seconds, so that's good. So which means your perfusion as well. And then I feel good about doing vitals, so now I'm just going to continue to do the head to toe. Is that okay?
Yes.
So I'm gonna first just inspect your arms. So your arms and hands, they look symmetrical. I'm not seeing any bruising or lesions or any discoloration, which is good. I notice you have a few moles, but those look normal and colorful and symmetrical. And then now I'm just going to assess for muscle tone. And they seem symmetrical, so your muscle tone seems good. Was that painful at all or anything like that?
No.
Okay, so now I'm going to assess for range of motion. I'm just going to hold onto your wrists while you move them in a circle. And then other way. So I noticed there's a few crackles there. Is that normal or abnormal, and is it painful at all?
Not painful, normal.
Okay. And then now I'm just going to have you move your arm up while I hold on to your elbow. Then I'm just going to do the other arm. So I'm not hearing any crackles there or feeling any crackles, but was that painful at all?
No.
Okay. And then now I'm just going, do you know how to swim?
Yeah.
So I'm just going to have you do 2 front strokes and 2 back strokes on each arm. So I'm just going to hold onto your shoulder while I do so. So you can just, and I'm just going to do your other arm. Now go ahead. So I didn't feel any crackles there. Was that painful at all or anything like that?
No.
Okay. So now I'm just going to assess for muscle strength. So I'm just going to have you hold your hands like this. I'm just going to have you push out while I push in, and then vice versa. And then I'm just going to have you put your hands like this. I'm going to have you push down while I push up, and then I'm going to have you flip your hands over and push up while I push down. So your muscle strength seems good. I'm not seeing any abnormalities there. And then next I'm just going to do cerebellar function. So I'm just going to have you make an OK symbol, and then I'm just going to have you touch your finger to each one, and then go backwards, and then do that as fast as you can. So your cerebellar function looks good there. Next for cerebellar function, I'm just going to have you put your arms like this. I'm going to flip them over and flip them back, and then I'm going to have you do that as fast as you can. So your cerebellar function looks good there. So far I'm not seeing any abnormalities. And next, for cerebellar function, I'm just going to, without moving your head, I'm just gonna have you touch your nose and then touch my pen light, touch your nose, touch my pen light, touch your nose, and then touch my pen light. So your cerebellar function is all good. I'm not seeing any abnormalities or anything like that at all. And then now I'm just going to move on to inspecting your head and your face. And so first, it looks symmetrical. I'm not seeing any differences. And then your part also still looks symmetrical as well. And so your head and your face both look symmetrical. So now I'm just going to inspect your hair. So I'm not seeing any lesions or bumps or bruises. I'm not seeing any acne or moles or dandruff or discoloration. And your part looks good. So for your head, for inspection, everything looked good. And then now I'm just going to palpate your head, so just let me know if there's any pain. Is that painful at all?
No.
Okay. And then next I'm just going to assess your eyes. So your face is symmetrical, like I said. For eyes, are you sensitive to light at all or anything like that?
No.
Okay. So I'm just going to have you look straight at me. And I'm just gonna... Okay. And then I'm also just going to have you look at my hand, and then look at my pen light, and then look at my hand, and then look at my pen light. So your pupils are round, they're symmetrical, they're reactive to light, and they're accommodating, which is good. And then now I'm just going to also assess more of your eyes. I'm just gonna pull down while you look up, and then while you look down, I'm just gonna pull up. So look up for me, and then look down. So your sclera looks good. It looks white. I'm not seeing any redness or any blueness, so I'm not seeing any infection. I'm not seeing any yellow, which means there's no jaundice. And then your conjunctiva, it looks pink, so there's no redness for infection, and there's no paleness, which means you're not iron deficient, which is all good signs. Now I'm just going to inspect your ears. So your ears look symmetrical. I'm just going to inspect the front and back side of your ear. I'm just going to do the other side. Okay. So I'm not noticing any redness behind your ear or in your ear, which means there's no infection. It's pink. I'm not seeing any like tubes or any like past infections of like scar tissue or scarring. So now I'm just going to palpate your ears. So just let me know if there is any pain. Any pain there?
No pain.
Okay. And then now I'm just going to assess your nose. So I'm just going to have you cover one, and then breathe in and out. And I'm just going to have you do the other. Okay, so that seemed good. It seems like your breathing and respirations were well. Now I'm just going to have you look up. I'm just going to assess the inside of your nose. Okay, so the inside of your nose seemed good. Your mucous membranes are attached. I didn't see any polyps or any septum deviation, and they look symmetrical, and I didn't see any infection or redness or anything like that. And then now I'm just going to move on to your cranial nerves. And so cranial nerve number 1, 2, and 8 are sensory. Cranial nerve number 5, 7, 9, and 10 are motor and sensory, and the rest are motor. Cranial nerve number 1, I'm just going to, it is going to be your olfactory. So I'm just going to have you close your eyes and smell something for me. Can you tell me what you're smelling?
Coffee.
Okay. And since you can smell that, I'm going to say your cranial nerve number 1 is intact. For cranial nerve number 2, that is your optic. Since we don't have a Snellen chart, I can't assess for that, but I can ask you if you have any contacts or glasses.
No.
And then do you go to the eye doctor at all?
Yes.
Do you, how often do you go?
Like once a year.
And so since you go once a year and get them checked, I'm going to say cranial nerve number 2 is intact. For cranial nerve number 3, 4, and 6, 3 is going to be your ocular motor, which is your eyes go in and downwards. 4 is going to be your 4 is going to be your trochlear, which is where your eyes move sideways, and then cranial nerve number 6 is going to be your accessory. No, that's what. It's going to be your abducens, and those are going to be your 6 cardinal fields of gaze. So I'm just going to have you look straight at me. I'm just going to have you try to follow my pen light and try not to move your head. So as you can see, those are intact. And then cranial nerve number 5 is going to be your trigeminal. That one I'm going to test for facial sensation. So I'm just going to have you close your eyes and tell me where I'm touching.
Forehead, left cheek, right cheek, chin, nose.
So I'm also going to just have you open and close your jaw for me. So since you can do that, and you assess those all correctly, your cranial nerve number 5 is intact. Cranial nerve number 7 is your facial, and so I'm just going to have you make some funny faces. So I'm just going to have you puff out your cheeks for me. Can you smile? Can you frown? And then can you make an angry face? So since you can do that, I'm going to say cranial nerve number 7 is intact. For cranial nerve number 8, it's your auditory, and so can you hear me well? Have you ever had an ear infection or anything like that at all?
No ear infections.
Okay. And so since you can hear me well, I'm going to say cranial nerve number 8 is intact, but we are going to come back to it later for the Romberg test. For cranial nerve number 9, 10, and 12, I'm just going to assess your mouth. For 9, it's going to be your glossopharyngeal. For 10, it's going to be your vagus. And then for 12, it's your hypoglossal. And so, first of all, your mouth looks symmetrical, your lips don't look cracked, and I'm not seeing any discoloration or any bruises or lesions. So I'm just going to have you stick out your tongue for me, and then just say ah. Okay. And then I'm also going to have you stick out your tongue for me, and then just move it side to side. And then could you smile for me? And then could you just show me your gums real quickly? Okay. So inside of your mouth, your uvula raised, which is good. I'm not seeing any redness, so no infections. I'm not seeing any discoloration, and your heart is up part, we're good, there's symmetrical, and I'm not seeing any tonsil stones. And then for your tongue is symmetrical, I'm not seeing any discoloration. And for your teeth, your teeth look good, there's no discoloration there, any abnormalities. And then for your gums, I didn't see any bruising or lesions or any discoloration there as well, or any bleeding. So that's all good. And so those cranial nerves are intact. And then for cranial nerve number 11, it's your accessory. And I'm just gonna have you shrug your shoulders for me. So cranial nerve number 11, since you can do that, that one's intact as well. And then now I'm just going to palpate your sinuses. And so I'm just going to do your maxillary and then your frontal as well. So this is your frontal. Is there any pain there?
No.
And then any pain here?
No.
That's your maxillary. And then now I'm just going to do your lymph nodes. So just let me know if there is any pain because I'm just going to palpate your lymph nodes. So this is your occipital. Any pain there?
No.
And then this is your postauricular and your preauricular. Any pain there?
No.
And then this is your submandibular and your submental. Any pain there?
No. And
then your cranial chain, cervical chain. Is there any pain there?
No.
And then I'm just going to have you hunch your shoulders forward for me. This is your supraclavicular. Any pain there?
No.
And then I'm also just going to test for tuger. So I'm not seeing any tenting, which means you're not dehydrated, which is also good. And then I am just going to quickly take a look at my paper. And then I'm just going to have you look up for me real quickly. So your trachea is in alignment. I don't see any discoloration or any lesions, and it's symmetrical. And I'm noticing that you have just a mole, but it's not discolored or anything like that. So I'm just going to listen for bruise. I'm just going to have you hold your breath each time, and then I'll give you a break in between. So you can just hold your breath. Okay, I'm not hearing anything there. And I'm just gonna do the other side. I'm just gonna have you hold your breath. And I'm not hearing any bruise there, so there's no washing notices there or anything like that, which is good. And then now I'm just going to palpate your for your carotid artery. I'm just going to do the other side. And so those seem good. They're symmetrical. Your rhythm's good. I'm not seeing any abnormalities there. And then now I'm just going to have you just turn to the side for me. Do you care if I
You're good.
just undo your okay. So your back looks good. It's symmetrical. I'm not seeing any like lesions or any bruising or any discoloration. I notice you have a few moles, but they look good. And your spine's in alignment. And then I'm just going to look at your side. So I can see that your respirations are good, that you are a 2-to-1 ratio. So you're not a 1-to-1 ratio, which is good, which means that you don't have any signs of any wheezing, any COPD or asthma, or any barrel chesting, which is all good. And then now I'm just going to take a look at your thyroid. So your thyroid looks good, it looks in alignment. Not noticing any discoloration or anything like that for your neck, and it looks symmetrical. So now I'm just going to move your thyroid, and I'm just going to have you swallow for me. Okay, go ahead and swallow. And then I'm just going to do the other side. Go ahead and swallow. Okay. Was that painful at all or anything like that?
No.
So like I said, there's no discoloration, which is good, and so that means there's no hypothyroidism, so your thyroid looks good. So now I'm just going to listen to your lungs. Can you just take a breath for me? And then just one more. So your lungs end right about there. And then I am just going to listen to your lungs and your lung sounds. And so I'm gonna do this 12 times. So if you need a break, just raise your hand. And then anytime I move my stethoscope, then you can take a new breath. Then right here. And then right here. So your lung sound sounded good. I didn't hear any whooshing or any crackles or wheezing or anything like that. And then now I'm just going to percuss. So I heard resonance, so that's good. So there's no abnormalities there. And then I'm just going to have you lie down for me. And then I'm just going to remove this pillow. So I'm just going to have you look that way for me. So I'm not seeing any jugular vein distension there. And then you can look towards me. I'm not seeing any jugular vein distension there either. And then I'm just going to have you just undo your top for me. And so I'm not seeing any discoloration in your chest, and it looks symmetrical. I'm not seeing any moles or anything like that, and I'm not seeing any lesions or any bruising. So now I'm just going to listen to your 5 heart sounds. So you have your clavicle, and then you have space, and then you have rib 1, space, rib 2, and then space, and that's your aortic. So S1 and S2 sound good, which is your lub dub. And then I'm just going to test for murmurs. and I'm not hearing any murmurs, which is good. And so then now everything else is on the left side. So here's your clavicle, and then it's space, rib 1, space 1, rib 2, and then space 2. So this is going to be where your pulmonic is. And S1 and S2 sound good. Now I'm just going to listen for murmurs. And it sounds clear. I'm not hearing any murmurs. And so then it's going to be rib 3, and then space 3. So this is your herbs. And so now I'm just going to listen to S1 and S2. So S1 and S2 sound good. I'm just listening for murmurs. And I'm not hearing any murmurs, which is good. And then it's going to be rib 4, and then space 4. So this is going to be your tricuspid. Listen for S1, S2. So S1 and S2 sound good. Now I'm just going to listen for murmurs. And it sounds all clear. I don't hear any murmurs. And then this is going to be rib 5, and then intercostal space.
Can move it.
You're fine. 5, and then you're going to be mid. So your clavicular. So you're going to be right here then, which is your mitral. So I'm just going to listen for your apical pulse for a minute. So I heard 64, which is good, which is in range. Now I'm just going to listen for murmurs. And I'm not hearing any murmurs in the mitral, so that is all clear. And then you can just pull up your top. And then now I'm just going to have you pull up your gown to your bra. So your abdomen looks good. I'm not seeing any lesions or bruising or any discoloration, and looks symmetrical. And I'm not seeing any abnormal movement. also not seeing any abnormal movement from down here. So it looks good. And then now I'm just going to listen for your vowel sounds. So I'm going to start in the left lower quadrant. And I heard 5 there. So now I'm just going to go to your right upper quadrant. Then I'm just going to move over to your left upper quadrant. I heard 5 vowel sounds over here. And then I heard 5 vowel sounds there, so I'm just going to move down to your left lower quadrant. And I heard 5 vowel sounds there. So your vowel sounds are active times 4, which is good. And then now I'm just going to listen to actually your arteries. So let's see, stomach, and then end of your xiphoid process. So meet in the middle. So this is your aortic artery, your aorta. And I'm just gonna listen for brays. One second. And I'm not hearing any brays. And then now I'm just gonna go over to your renal. I'm not hearing any brays there. And then now I'm gonna go to your right renal. And I'm not hearing any brays there. And then now I'm just gonna go to your left iliac. I'm not seeing any brays there, or hearing any brays there, any whooshing noises. So now I'm going to go to your right iliac. And I'm not hearing any brays there or anything like that, so that's good. And then now I'm just going to do percussion. Timpani, 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 timpani. So that sounds good. Now I'm just going to do it up to your liver. Timpani, timpani, timpani. Dull. So your liver is right about there, which is a good placement for it. So there's no distension, which is good. And then now I'm just going to do palpate. So I'm just going to do light palpation, and just let me know if there's any pain. I'm just going to watch your face. Any pain there at all?
No.
And I didn't see any signs of grimacing or anything like that. So now I'm just going to be doing deep palpation, and same thing, let me know if there's any pain. Any pain there?
No pain.
And so there's no, I didn't notice any pain or any grimacing in your face or anything like that, so that's good as well. You can just cover your gown for me, hold down your gown for me, and then I'm just going to have you, can you make a frog position or like a yoga pose for me? I'm just gonna check for your femoral artery. So I'm right here. And then I'm right here. And they're symmetrical. I'm feeling a good rhythm and a good heartbeat, so that's good. And they are strong. So now I'm just going to listen for bruise in your femoral artery. And I'm right here. And I don't hear any bruise there. And I'm right here. And I'm not hearing any bruise or wishing noises there, so that's all good. And then I'm just going to look at my paper real quickly. So now I'm just going to uncover your legs. Is that okay?
Yes.
And I'm just going to take your socks off. And your legs look symmetrical. I'm not seeing any bruising or any lesions or anything like that. And I'm not seeing any abnormalities. So now I'm just going to assess for muscle tone. So they're symmetrical. Is there any pain there?
No.
And then now I'm just going to look for edema. So I'm not seeing any pitting, which means there's no edema, and I'm not seeing any swelling either, which is good. And then now, also your temperature feels good on your legs, so that's good. And then now I'm just going to do capillary refill on your toes. So your capillary refill was within 3 seconds, which means your perfusion's good. And now I'm just going to inspect in between your toes. So it looks symmetrical. I'm not seeing any lesions or bruising or any discoloration, which is good. And then now I'm just going to do your pulses. So if I could just have you bend your knees for me. So this is your popliteal pulse. And so it's symmetrical, it's a good rhythm, and a strong pulse, so that's good. Now I'm just going to do your posterior tibialis. And your posterior tibialis is symmetrical, it's a strong pulse and a good rhythm, so that's good. And then now I'm just going to do your dorsalis pedis. And your dorsalis pedis is symmetrical. It's a good rhythm and a good pulse, so I'm not seeing anything wrong there. And then now I'm just going to assess for sharp and dull. So if you just want to lay your legs flat for me. So for instance, this is sharp.
Okay.
And then this is dull.
Okay.
So I'm just gonna have you close your eyes and tell me what leg it's on and where at.
Sharp right thigh.
dull left thigh, sharp right knee, sharp left shin, sharp right shin, sharp left knee, dull right foot, dull left foot.
Okay, and so you only got 2 wrong, which is okay, since it is kind of hard to tell on a Q-tip, but there isn't really any abnormalities with your sharp and dull sensation. And then now I'm just going to have you sit on the side of the bed for me. I can tie this for you. So now I'm just going to do range of motion on your legs. So I'm just going to have you move your ankles in a circle for me, and then the opposite way. So I'm not noticing any crackles there. Was that painful at all or anything like that?
No.
Okay. And then now I'm just going to have you kick out both your legs for me. Was that painful at all or anything like that? I didn't hear any crackles.
No, it wasn't painful.
Okay. And then now I'm just going to test for muscle strength. So I'm just going to have you push against me inwards, and then just push against me outwards. And then I'm just going to have you push up while I push down, and then push down while I push up. So your muscle strength is good there. I'm not seeing any abnormalities there, which is good. And then now I'm just going to do your reflexes. So I'm just going to have you close your eyes for me. And so your reflexes seemed good and reactive, which is good. And then now I'm just going to have you put on your socks for me. And then are you dizzy at all or anything like that?
No.
So I'm just going to have you stand up. I'm just going to have you spread your legs apart, shoulder width. And I'm just going to have you put your arms on your side. And I'm just going to have you close your eyes, and we're just going to stand here for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So for the Romber's test, I saw a little bit of swelling, but not a lot, which is good. And so for your Romber's test, I'm going to give you a negative Romberg's, which is good. So I feel good with you walking, which is also cranial nerve number 8, which is auditory. And so I'm just going to have you take a few steps forward for me this way. And I'm just going to have you pivot. And then on your way back, I'm just going to have you do heel to toe. I'm just going to have you sit down. And then since you are movable, you're mobile, active, I didn't see any friction shears, you're not incontinent, I didn't see a ton of moisture, your nutrition and exercise are both good, and yeah, so I feel good with giving you then a 23 on the braided scale. And I'm just going to look at my paper one last time. And I feel good with emptying the head to toe.